Hey guys, my name's Alyssa. I'm one of the hygienists here.
And I'm Emily. I'm also a hygienist. Alyssa, what if
Yes,
we talk about gum disease today?
let's do it. So exciting.
Okay.
Okay,
So, how would we know? If you have gum disease, how would you know?
so basically you come in, we take some x-rays, we do measurements of your gums because we're measuring the health from the tissue down to your bone level. Based off those findings, typically we'll go over to see if you have some bone loss with radiographs, see if there's any buildup, any points of bleeding, and from those findings, we'll diagnose needed scaling and root planing. Okay, so you've been diagnosed with scaling and root planing. What is scaling and root planing?
Okay, scaling and root planing or a deep cleaning is because you have an infection in your gums, otherwise known as periodontitis. That's a big word that we use, but gum infection is what it is. So you'll come in for an appointment, and sometimes we do half of your mouth at a time. Sometimes we do your whole mouth. And we will use something to help you be more comfortable. So now that you're comfortable and numb, what would be our next step?
Okay, this is the fun part, the nitty gritty, the stuff we love to do. We get to go in there and actually clean out that active infection or that bacteria and the buildup that we like to call tartar. That tartar is attached to the root surface of your tooth, so that's why you're numb. We get to go in there, remove all that, make sure it's nice and smooth for you, and then we'll flush out the pocket or the tissue, the space between the tooth and the tissue, and get you back to a quote unquote healthy standpoint. With that being said, periodontal disease or periodontitis is considered an active infection until we get you to a state of remission. So we like to tell patients that it's like having high blood pressure or diabetes. You're never gonna be completely healed of it. It will be something that you will have to maintain the rest of your life. But our goal is to get you to that healthier stepping stone to healing.
After we complete the deep cleaning, we will see you 4 to 6 weeks later. We're going to reevaluate the measurements that we did the first time to see which areas are healing and if any areas need some extra help. And you have a job that you get to do at home. We do expect that you'll floss your teeth. Every day is the goal, once every 24 hours, to disrupt the bacteria that's underneath the gums. And that will help keep things so much healthier.